Hello, I'm Dr. Arshnur from Dr. Arshnur Institute. I've started a series of role plays for doctors and nurses, and today's role play is for doctors. This role play is about an elderly person, recurrence of UTI, that is urinary tract infection. It's an interesting role play, but before I start the video, I would like to give you some important information that is regarding my book. My being launched in the month of January, in the first week of January. That is, the book will definitely help the doctors. And the name of that book is Crack OET at First Attempt. And this is my wish to all of you, that you should crack OET at the first attempt. An ultimate guide to doctors and nurses. It has 20 writing samples and 20 speaking samples that it role plays. I have chosen different type of the role plays, and what I've clubbed, what is the uniqueness of this book, that one role play will help 5 to 6 other role plays of that category. Suppose it is lifestyle modification, we'll be having some role plays which will be covering obesity, hypertension, diabetes, and all that. So if you want to book the copy, then you can book it right now, because you'll be getting it at 50% discount before the launch. Fine. So now I'll start with the role play. So this role play, the setting is clinic, and doctor, you are consulting an 88-year-old patient who lives independently, and he had given his urine sample. The patient has reoccurrence of the urinary tract infection. For that reason, he is very much concerned. First part, that is obviously the introduction part. You have to start the topic by introducing yourself. My name is Dr. Dash and Dash. I am your attending doctor today, and I'm doctor in charge in this clinic. How may I help you? Then the patient will tell that, doctor, I have come for my urine examination. Then you have to tell that, yes, I've got your report for the urine investigations. But before I would start with this, I would like to know that how would you like to be addressed? The patient may say that I am Sam or Matthew. You may say by any name, let it be Sam. So as this patient is an elderly patient, we have to give the respect to this patient. You may say that, Mr. Sam. Don't forget to use Mr. and Miss for MS Miss for the elderly patients. Yes, Mrs. Sam, I have got your result for the urine sample here, and you have been diagnosed with urinary tract infection. As a patient is already the patient of UTI, or he already had this, and he's fed up of having this again and again. Then he'll say that I'm so much worried that why this is occurring again and again. Now you want to gather his information about his past, then ask him some questions regarding this. So you may say, Mr. Sam, can you please elaborate it a bit more to me? When did you have UTI last time? Then he'll say that it was the severe UTI I had last month. Then you should show some empathy by saying, I'm so sorry to hear this. And now I would like to know about your lifestyle, as this might be the reason for the reoccurrence. I'll get some insight for this, and I'll help you to explain that. Before I could help you, I would like to ask certain question. If you're comfortable, may I ask? The patient will say, yes, you may ask me anything. So then it is obviously the patient is 88 years and he might not be working. Then you can ask directly that, Mr. Sam, can you please tell me about your daily routine? He'll say that, I love to live independently. I'm an easygoing person and love my independence. Then you should appreciate this, that I appreciate that even at this age, you are living independently. Then the patient will tell that I am taking plenty of fluids and I'm diet conscious and doing exercise regularly for 15 to 20 minutes. Then again, you should appreciate that I would congratulate you for your concern about your healthy lifestyle. Because I've seen at this age, people do not take care of themselves, and that is a reason they are prone to many diseases. But in your case, it is totally different, that you're taking proper diet, taking plenty of fluids, and doing exercise. And this is the reason that you are otherwise living healthy and you are fit and fine. As a reoccurrence of UTI is happening in your case, there might be some reason. There may be that you're not completing the course, or that may be non-compliance with the medicine, or you're leaving your course in between, or there might be some common source in the washroom or the clothes you're wearing. You have to tell the patient regarding that. Now, highlight the good hygiene is then also important, and educate the patient on double voiding. That is, um, tell the patient that, Mr. Sam, I'm going to give you some instructions to avoid this in the future. First of all, must keep your personal hygiene properly. I mean to say that change your undergarments regularly, and it is preferable that you should use clean and new garments. Do not reuse any garment you worn already. And if it is possible, then you can soak this in some antiseptic like Dettol or Savlon, and then you can dry it in the open sun, then wear this. Apart from this, what is more important, that is your washroom. Clean the washroom properly with phenyl or any disinfectant, because this may be the source of reoccurrence of the urine infection again and again. As you are already a happy going person and health conscious person, in this way, if you take care of all these precautionary measures in the future, there will be minimal chances of getting UTI in the future. Then you can add one thing more, that it is given there, double voiding. That is, Mr. Sam, when you're going to the washroom for urine, at that time, sit calmly. Do not rush to pass the urine immediately. First, when you the whole urine that comes out and you feel light, keep on sitting for some time, so that you should do double. Again, if there is any urine left in the bladder, that should be emptied. Your bladder should be emptied. This is double voiding. And again, suggest treatment with the antibiotics. Now, I'm prescribing you some antibiotics. These should be taken properly. Mr. Sam, proper compliance with the medicine is mandatory in your case. This might be one of the reasons that you are having the reoccurrence of UTI, that you are not completing your prescribed dose, as it is important for you to complete the course of antibiotics for 7 days. You have to take it for that much time. And if you are stopping the antibiotics by 5 days or 6 days, in that case, you are prone to the infection again and again. And the last is the reassurance the patient with the dedication, and the patient you expect to be able to resolve the UTI issues that we have already discussed. Mrs. Sam, as you're already too much concerned about your health, that is a commendable aspect of your life. You are taking care of your diet, you're taking plenty of fluids, you are doing regular exercise. At this age, if you are leading a healthy lifestyle, this is the best way to keep yourself fit and fine and have a longevity of your life and to enjoy your life. But if you take care of these precautionary measures, in this way, you will get rid of UTI very soon. Must have a proper compliance with the medicine. Keep your personal hygiene maintained, and keep your washroom also cleaned and disinfected. Hope this video will help you to get some important points to be discussed in the exam, or for your self practice also. Um, And if you like this, do not forget to like and share it with your friends so that other people should be benefited by this. And if you want me to make some other videos on some particular topic, must write me in the comment box. I'll prepare those videos also. Now, at the end, I will definitely say that if you have not subscribed my channel yet, subscribe it right now so that you should get the notification on the latest updates on my channel whensoever I'm uploading any new video on this channel. Stay healthy, happy learning. See you soon with a new video. Till then, stay healthy.